My name is Helen Chu. I'm professor of medicine and epidemiology in the schools of medicine and public health at the University of Washington. So there has been a rising anti-vaccine movement in the United States. And I think the first thing to know, which is really important, is that most people are getting their vaccines on time. And most people are getting all of the vaccines that are recommended by their doctor for themselves and their children. So the choice that is in line with the majority is to get all of your vaccines. Part of the reason why there has been an anti-vax movement, I think, is because of a rising distrust in science and a sense that the public is not being told what is happening. And I think one of the ways that we try to address that is by having conversations as doctors with our patients and addressing their concerns, and also making sure that the public does know that vaccines are safe and that there's an entire set of people who are devoted really to studying all of this and making sure that anything that comes up is addressed and that we make policy decisions based on the best, newest, most available data. Advisory Committee on Immunization Practices was founded in 1964 and has been in place for over 6 decades. And the point of this committee was really to make recommendations for use of vaccines in the United States. And one of the main things it does is it reviews the data and helps decide which vaccines are recommended and therefore which vaccines are paid for by health insurance companies and often by the federal government, particularly for children without health insurance. Up until last month, I was a voting member of the Advisory Committee on Immunization Practices. And last month, RFK dismissed all the current members of the ACIP and replaced them with new members who have made new vaccine recommendations for use in the United States. And so we're at a time right now where we're trying to just figure out what is the best next step in terms of science-based vaccine recommendations. As the ACIP has changed its membership and switched to a panel with individuals who may have different views on vaccine safety in the United States, the recommendations will change. So one of the main things that's happened is they voted on use of multi-dose flu vaccines. There is a component in the flu vaccines which is called thimerosal, which is safe and used as a preservative and to prevent bacterial growth. What happened as a result of the ACIP decision was that those types of vaccines that contain the thimerosal are no longer recommended for use in the United States. And so therefore, you can't purchase multi-dose vaccines anymore. And what that really impacts are places like nursing homes, where older adults need vaccines, and often they deliver them using these multi-dose vials. So people who are in nursing homes who need vaccines now need a different way to be able to get their multi-dose flu vaccines. So that's one example of the way that the impact of this new panel has already changed the way we're going to administer vaccines in the U.S. So the way that ACIP works is that it reviews the data from before the vaccine is licensed, so the clinical trial data where we look at the adverse events and the safety of the vaccines when they were studied, and then also after it's licensed. So after the vaccines are approved for use in the United States, the ACIP reviews all of the data that comes in from, for example, Kaiser Permanente, and they see all of the population level data and are able to look and make sure that it remains safe when it's rolled out to the general public. And this happens regularly. So before the vaccine is licensed, we look at the clinical trial data and we use that to make the decision. And then after the vaccine is licensed, we review on a very regular basis, particularly right after the vaccines are licensed, to make sure that the safety signals that, for example, may have come up in the clinical trials are either no longer present, or if they are present, that we actually change our recommendations. The ACIP recommendations are the backbone of insurance payments for vaccines in the United States. So they form the schedule for vaccines that are recommended for use for adults and children. And so it impacts the people who get it paid for from private health insurance, and then it also impacts what is covered through a program called Vaccines for Children, which covers half the children in the United States. Every vaccine that's recommended for use has been shown to be safe and effective and to save lives. And so a change to the way that we review vaccines and a way that we sort of look at the evidence around its safety and its effectiveness has a substantial impact, I think, on the health of Americans. So what we know now is that the current childhood vaccine schedule has been highly optimized, really to reduce the number of doses that children have to receive. It really aligns with the pediatric visits. And so one of the concerns, I think, that has come up with the childhood vaccine schedule is the amount of times people or children are getting vaccines and the number of vaccines that they're getting. I think one of the important things to realize is that though the number of diseases that you're protected against has increased, the amount of foreign substance that you're getting as part of each vaccine is actually much, much lower than, say, in the 1960s or the 1950s, because the vaccines are just better. They're cleaner. They have less side effects. They contain small pieces of the virus or the bacteria, much smaller pieces than they used to contain, and so they protect you with actually exposing you to much less than in the past. And the amount of side effects that we see with childhood vaccines has gone down significantly as time has passed and as vaccine technology has improved. So right now, the concern, I think, from the new ACIP, and I can't really speak for them, but I think is that they want to reduce the number of childhood vaccines that children are getting each visit, either to space them out or to eliminate them completely. And what this will happen if you do this, and the main example I would use right now is measles vaccine. There's a measles outbreak that's happening across the United States. We're at risk of losing our measles elimination status in the United States. And there is a concern by the anti-vaccine community that measles vaccines are associated with autism. I think that is driving a lot of this conversation about getting MMR vaccine as a child. And I think potentially what could happen is that this skepticism about MMR and potentially a change to the vaccine schedule where MMR is potentially either made optional or allowed to be delayed until later or spaced out further, those all have the direct consequence of making fewer people immune to measles, both immediately and then also decreasing the herd immunity that we have to prevent more vulnerable people from getting measles. I think we're already seeing the impact to loss of measles containment in the United States as we've seen measles cases increase and ongoing local transmission of measles. What has happened is that children are getting sick, but also the people around them are getting sick. And I think people have forgotten how bad measles can be when you're a child, that not only does it have short-term consequences of making you very sick with pneumonia, with infection of your brain, with all sorts of other things that can happen immediately. It also has a lot of long-term consequences, and some of those long-term consequences include making your immune system not work as well and not respond to other diseases as well. And then you can also get later consequences of having measles infection that show up 5 to 10 years later. The other things that we worry about are obviously the people who live with kids with measles. So even if a child gets measles and gets a fairly mild case, they can still infect a pregnant woman in the household or their older family member or someone who's immunocompromised who happens to be in the same classroom as them. And those people don't have the ability to control their measles infection, and they can get quite sick. It's hard to predict what the consequences of the fiscal consequences are. I mean, I think one example that you can think about is COVID, right? So when you control COVID transmission in the United States, what happens is that people do not end up accessing hospital care because they don't become severely sick with COVID. And the more hospitalizations you have, the higher the cost to the healthcare system. And not only is the cost higher, but there can be surges in activity that lead to overwhelming of the healthcare system that makes it impossible to be seen for other things at the same time. So getting treatment for a heart attack or getting treatment for a broken bone, things like that will be impacted if you have large, sustained numbers of severe cases of any disease. And we saw this with COVID, and we are likely to see this with other vaccine-preventable diseases as the numbers tick up. Yeah, I think people have forgotten how bad vaccine-preventable diseases can be. So how bad polio was in the 1950s, how bad measles was, how bad pertussis can be. And as things are coming back, we're starting to see that come. We can start seeing those cases. We can see the cases in people who are more vulnerable. We can see them in older adults and in people with cancer. And I think as we look around us and see the resurgence of all these vaccine-preventable diseases, it's just really important to remember that vaccines are safe. Vaccines are safe. They're safe the way that they're given. They're safe the way they're designed. We've spent a lot of time making sure that they're safe. And not only have we made sure that they were safe before we started giving them, but we continue to assess the evidence and make sure that they are safe. And if ever there were a situation where we thought the vaccines were not safe, then certainly we would take action and make that known. I think that's a little bit harder to comment on. I mean, I think in so many ways we're being asked to do things now that are highly preventable in research and in disease containment. In almost every aspect of, I think, our lives, we're working on things that are sort of a reaction to changes that have been made and not necessarily moving the science forward. So for example, rather than focusing on containment of measles and stopping the next outbreak of measles, we could be working on developing novel vaccines for new diseases, focusing on responding to the next potential pandemic. There are other things that we should be spending our mental energy on right now than containing the diseases for which there is a vaccine that is safe and highly effective. There's a lot of research that's happening at the University of Washington on vaccines. Some of the specific examples include designing new vaccines, such as at the Institute for Protein Design, where they're really working on making the next generation of vaccines, all the way over to the work that's being done at Seattle Children's and the School of Public Health on vaccine hesitancy and how to talk to parents about vaccines. So there's really work across the spectrum. All of that is being impacted right now by what's happening with the federal research landscape, but there's quite a bit of work. There's also a lot of vaccine trials that are happening, both for use of current vaccines as well as newer vaccines that have newer platforms to develop to be able to deliver the vaccines in different ways. Well, I think one of the things that we've been focusing on is what is the next step now, given that we are in a situation where potentially the vaccine decisions that are being made nationally may not be in line with the known scientific evidence. And so Washington State, as well as several other states, as well as many professional organizations in the United States, including the American Academy of Pediatrics, are working hard right now to really look at the evidence and be able to make science-based recommendations for vaccines for use in the US.